Welcome to our in-depth exploration of anxiety disorders. In today's fast-paced world, where stress and uncertainty are prevalent, understanding anxiety has never been more crucial. Anxiety disorders are a widespread challenge affecting millions worldwide. Our aim is to shed light on this complex topic, offering insights into the types of anxiety disorders, their symptoms, underlying causes, and the multitude of treatment options available. We'll delve into real-life examples, practical self-help strategies, and the crucial role of support systems. By the end of this comprehensive guide, you'll have a deeper understanding of anxiety disorders and the tools to help yourself or support others on their path to recovery. Let's embark on this journey together. What is anxiety? Anxiety is a natural and often adaptive response to stress or perceived threats. It is a complex emotion that manifests as feelings of unease, apprehension, or fear. In moderate levels, anxiety can serve as a valuable mechanism, helping us stay alert and responsive to potential dangers. However, when anxiety becomes chronic or overwhelming, it can lead to an anxiety disorder, a mental health condition characterized by excessive worry and fear that interferes with daily life. These disorders can encompass a wide range of symptoms and intensity, from generalized anxiety to specific phobias. Understanding anxiety is the first step in managing and addressing its impact on mental well-being. What are types of anxiety disorders? Generalized anxiety disorder, GAD, is marked by persistent and excessive worry about various aspects of life, often with no specific trigger. People with GAD may experience restlessness, muscle tension, fatigue, and difficulty concentrating. Social anxiety disorder, also known as social phobia, this disorder involves an intense fear of social situations and the scrutiny of others. Individuals with social anxiety may avoid social gatherings and experience intense anxiety when facing social interactions. Panic disorder. Panic disorder is characterized by recurring and unexpected panic attacks. These episodes involve sudden, overwhelming fear, accompanied by physical symptoms such as a racing heart, shortness of breath, and chest pain. Specific phobias. Specific phobias are intense, irrational fears of particular objects or situations, such as heights, spiders, or flying. Exposure to the phobia trigger can lead to extreme anxiety. Obsessive-compulsive disorder, OCD. OCD involves recurrent, intrusive thoughts, obsessions, and repetitive behaviors or rituals, compulsions, performed to alleviate anxiety. Common obsessions include fears of contamination or harm. Post-traumatic stress disorder, PTSD. PTSD develops in response to a traumatic event or an accident. Symptoms include flashbacks, nightmares, hypervigilance, and avoidance of reminders of the trauma. Agoraphobia. Agoraphobia is characterized by an intense fear of situations or places where escape might be challenging or where help may not be readily available. It often leads to avoidance of crowded spaces. Separation anxiety disorder, more commonly seen in children, separation anxiety disorder involves excessive distress when separated from attachment figures, leading to a reluctance to be away from them. What are the common symptoms of anxiety disorder? Anxiety disorders encompass a wide range of symptoms, both physical and psychological. These symptoms can vary in intensity and duration depending on the specific disorder and the individual. Common symptoms of anxiety disorders include physical symptoms: increased heart rate, feeling as though your heart is racing or pounding; muscle tension, persistent muscle tightness or discomfort, often in the neck, shoulders, or back; sweating, excessive sweating, particularly in stressful situations; shallow breathing, rapid, shallow breaths, sometimes leading to hyperventilation; digestive issues, nausea, stomachaches, or diarrhea due to the body's fight or flight response; trembling or shaking, uncontrollable trembling or shaking of the hands or body; fatigue, feeling tired and drained even without physical exertion; restlessness, an inability to sit still or a constant feeling of needing to move; insomnia, difficulty falling asleep or staying asleep, often due to racing thoughts; dizziness or lightheadedness, feeling faint or dizzy, sometimes leading to panic attacks. Psychological symptoms: excessive worry, persistent, uncontrollable worry about various aspects of life. Irrational fears, intense fear or phobias related to specific situations or objects. Feelings of dread, a sense of impending doom or catastrophe, even in the absence of a specific threat. Difficulty concentrating, trouble focusing or maintaining attention on tasks. Irritability, increased irritability or a short temper. Restlessness, anxious individuals may feel on edge or restless. Avoidance behavior, avoiding situations, people, or places that trigger anxiety. Intrusive thoughts, distressing, unwanted thoughts that can be difficult to control. Panic attacks, sudden and intense episodes of extreme anxiety, often accompanied by physical symptoms like a racing heart, chest pain, and a feeling of impending doom. Compulsive behaviors, in conditions like OCD, individuals may engage in repetitive behaviors or rituals to reduce anxiety. It's essential to remember that experiencing some of these symptoms from time to time is normal, especially in stressful situations. However, when these symptoms become chronic, intense, or interfere significantly with daily life, it may indicate an anxiety disorder. What are the causes and triggers of anxiety disorder? Anxiety disorders are complex conditions, and their causes and triggers can vary from person to person. They often result from a combination of factors, including genetics, brain chemistry, life experiences, and personality. Here are some common causes and triggers of anxiety disorders. Genetics, a family history of anxiety disorders or other mental health conditions can increase the risk of developing an anxiety disorder. There may be a genetic predisposition that makes some individuals more susceptible. Brain chemistry, imbalances in neurotransmitters, the brain's chemical messengers, can contribute to anxiety disorders. Low levels of serotonin, in particular, are associated with increased anxiety. Trauma and stress, exposure to traumatic events or chronic stress can trigger anxiety disorders. Trauma, such as physical or emotional abuse, accidents, or natural disasters, can lead to conditions like post-traumatic stress disorder, PTSD. Childhood experiences, adverse childhood experiences, including neglect, abuse, or a dysfunctional family environment, can contribute to the development of anxiety disorders later in life. Personality traits, certain personality traits, such as perfectionism, excessive worrying, or a tendency to be overly cautious, may increase the risk of developing anxiety disorders. Physical health conditions, chronic medical conditions, particularly those involving chronic pain or chronic illness, can be associated with heightened anxiety. Substance abuse, the use of drugs, alcohol, or other substances can both trigger and exacerbate anxiety disorders. Withdrawal from substances can also lead to anxiety symptoms. Environmental factors, living in a high-stress environment, experiencing a major life change, example, divorce, job loss, relocation, or ongoing exposure to stressful situations can contribute to anxiety disorders. Cognitive factors, negative thought patterns, such as catastrophizing or excessive worrying about the future, can contribute to anxiety disorders by maintaining a state of heightened anxiety. Neurological factors, certain medical conditions, such as thyroid disorders or neurological disorders, can mimic or exacerbate symptoms of anxiety. Chronic health conditions, conditions like chronic pain, asthma, or heart disease can increase anxiety levels due to concerns about managing the illness. Medications, some medications, including certain stimulants, steroids, and thyroid medications, can have side effects that trigger or exacerbate anxiety. What are the diagnosis and assessment of anxiety disorder? Diagnosis and assessment of anxiety disorders are crucial steps in understanding and effectively managing these conditions. Mental health professionals use various methods and tools to evaluate individuals who may be experiencing symptoms of anxiety disorders. Here's an overview of the diagnosis and assessment process. 1. Clinical interview. A thorough clinical interview is typically the first step in the assessment process. During this conversation, a mental health professional, such as a psychiatrist, psychologist, or therapist, asks the individual about their symptoms, medical history, family history, and life experiences. This interview helps gather essential information to make an initial assessment. 2. Diagnostic criteria. Mental health professionals refer to the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. The DSM-5 provides specific criteria for diagnosing different anxiety disorders, ensuring standardized assessment and diagnosis. 3. Self-report questionnaires. Patients may be asked to complete self-report questionnaires or scales designed to assess the severity and nature of their symptoms. These assessments help gauge the presence of anxiety symptoms and their impact on daily life. 4. Physical examination. In some cases, a physical examination and medical tests may be conducted to rule out any underlying medical conditions that could be contributing to anxiety symptoms. Thyroid disorders or other medical conditions can sometimes mimic anxiety. 5. Psychological assessment. In addition to interviews and questionnaires, psychological assessments may be used to evaluate specific aspects of an individual's mental health. These assessments can include structured interviews, personality assessments, or cognitive assessments to identify cognitive patterns associated with anxiety. 6. Behavioral observation. Mental health professionals may observe a patient's behavior during the assessment process to note any anxious behaviors or tendencies. This observation can provide valuable insights. 7. Differential diagnosis. Differentiating between various anxiety disorders and ruling out other mental health conditions, example, depression, bipolar disorder, is an essential part of the assessment process. This helps ensure an accurate diagnosis. 8. Duration and persistence. Assessments also consider the duration and persistence of symptoms. A diagnosis of an anxiety disorder typically requires that symptoms have persisted for a specific duration, usually at least 6 months, and have a significant impact on an individual's life. 9. Cultural considerations. Mental health professionals should consider cultural factors that may influence the expression of anxiety and tailor assessments and treatments accordingly. Some cultures may have specific beliefs and coping mechanisms related to anxiety. 10. Collaboration. Collaboration among healthcare professionals may be necessary. For instance, a primary care physician might work with a mental health specialist to provide a comprehensive evaluation and ensure holistic care. How to treat anxiety disorder. Treatment for anxiety disorders typically involves a combination of therapeutic approaches, lifestyle changes, and sometimes medication. The choice of treatment depends on the specific type and severity of the anxiety disorder. Here are various treatment options. 1. Cognitive behavioral therapy, CBT. CBT is one of the most effective treatments for anxiety disorders. It helps individuals identify and change irrational thought patterns and behaviors that contribute to anxiety. This therapy equips individuals with coping strategies and tools to manage anxious thoughts and situations. 2. Exposure therapy. Exposure therapy is often used to treat specific phobias and PTSD. It involves gradually exposing individuals to the feared object or situation, helping them become desensitized to it over time. 3. Medication. In some cases, medication may be prescribed to manage anxiety symptoms. Common medications include selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, benzodiazepines, short-term use, and beta blockers for performance anxiety. 4. Mindfulness and relaxation techniques. Mindfulness meditation, progressive muscle relaxation, and deep breathing exercises can help individuals manage anxiety by promoting relaxation and reducing physiological symptoms. 5. Dietary and lifestyle changes. A healthy diet, regular exercise, and sufficient sleep can significantly impact anxiety levels. Avoiding excessive caffeine, alcohol, and nicotine can also help reduce anxiety. 6. Support groups. Joining a support group or therapy group for individuals with anxiety disorders can provide a sense of community, validation, and shared coping strategies. 7. Alternative and complementary therapies. Some people find relief from anxiety through practices like yoga, acupuncture, massage therapy, and herbal supplements. While these approaches may not replace traditional treatments, they can be complementary. 8. Art and expressive therapies. Art therapy, music therapy, and other forms of creative expression can provide an outlet for emotions and a means of self-expression, which can be particularly helpful for individuals with anxiety. 9. Self-help resources, books, websites, and mobile apps dedicated to anxiety management can provide valuable information, techniques, and exercises to help individuals self-manage their symptoms. 10. Family therapy. In cases where family dynamics contribute to anxiety or create additional stress, family therapy can help improve communication and support. Treatment plans should be individualized, taking into account the specific needs and preferences of the individual with an anxiety disorder. Please like, subscribe, and share our channel to help spread awareness and knowledge about anxiety disorders and mental health. Thank you.